video on something that I've learned since moving here, which is how to properly see if your horse has back pain. This is something that I've seen a lot of people try to do, and I've tried to do myself incorrectly after coming here and being taught how to do it properly by the sports medicine vet that I work for. So I'm going to show you how to do it properly. So first, the best way to test for back pain caused by Palpate is to, and I'm using a stool because he's tall, but put your hands on both sides of the withers and then press together. And some responses that you're going to look for is their head going up, them hollowing out in their back. Sometimes they'll try to move away from you. He's not really having much of a reaction to that. You can't really see his head, but he doesn't have much of a reaction there. And then what you want to do, and this is where most people go wrong, is you'll see a lot of people when they're testing the back, they'll put their hand like this with fingers on each side of the spine and push down. You're going to get just about any horse to react like that. And so it's not a good test of if they actually have back pathology and back pain. It's more just annoying the horse. So what you're going to do is you're going to make claws, and you're going to go right along the top of their spine, right in the center of their back. And you're going to push down pretty hard. And I'll do this from the other side so that you can see his back. He's having a very small amount of a response, but nothing bad. And you do that all the way until you get to the back here, and then you do something else, which I'll show you in a minute. So I'll go do that from the other side. All right, so again, right on the middle, not like this, on the middle. You're going to push down. You can see he's having a little bit of a response there. That's nothing severe. You'll see some horses that drop to the ground. That was a little bit bigger. He has had some back pain. He just recently got shockwaved and could possibly use it again, but that's not too terrible. It's a mild to moderate response. And then when you get back here, you're going to palpate. They have these two bumps. This is how you test for the SI. You're going to go right off midline. You'll feel two hard bumps. You're going to push down there, and he has basically no response to that. So that's the only time you're going to go on both sides. You get back behind where the saddle, the western saddle would go. You'll feel the two bumps there, and push. He doesn't really have any response to that. So once again, test for saddle fit. Hands on both sides of the withers, push together. Back, you're going to go right on midline and push down, all the way down the back. And then you're going to feel, palpate for those hard bumps, and you're going to push straight down. I know this horse, and he's not really a kicker. I've seen his back palpated before, so I'm not too worried being up here. If you're doing it on a new horse that could potentially have some pretty severe back pain, you might want to come up towards the shoulder and reach as you're going so that you stay out of the aim of that back foot. And also, I would suggest, he's in the cross ties, I would suggest not doing it in the cross ties the first time, having someone hold them in case they do freak out. Because horses that are really painful in their backs can have a really good response to this. Alright, this is Lance, and I am just going to show you the same thing on a different horse. So again, testing for saddle fit, you push here, no response, not on both sides, right down the middle, right down. See, he has a little bit of response right there, but not much. So you can see there he had hardly any response. Now, just to show you, he's a little bit more response. Of course, if I go on both sides, I can get a lot of response doing what most people do when they go on both sides of the spine and push down, even though he's a horse that doesn't have much back pain if you're going down the middle. So that would be a improper diagnosis to how he's responding to back palpation if you reported that he was sensitive, but you were palpating him like this. So once again, it's very important that you just use the tips of your fingers down the middle of his spine, use fairly heavy pressure, and then again, I'm going to walk him forward a little bit. test that SI, you're going to run your hands down the back until you feel the 2 bumps right at the top point and push down. He has a very little bit of a reaction. You can see him tense through here. That is not a whole lot of reaction for SI. Horses that have really bad SIs will practically sit on the ground. So there's another horse. So with back pathology, there are a few things that you can have. A lot of people attribute it to poor saddle fit, but it is very rarely actually attributed to that from what my vet has told me, who has done a lot of research in sports medicine and is known worldwide. And like I said, to test your saddle fit, the most common place they're going to be sore from the saddle is here. They don't have a response there, you're probably fine saddle fit wise. They can have something called kissing spines, which is when the spines of their vertebrae will rub up against each other and sometimes even fuse, causing pretty severe pain and arthritis in their back. And then they can actually get arthritis in between the vertebral bodies on their spine. So when you place a saddle on, it can cause them to twist and grind and even pinch nerves. So back pain can be very severe. The problem is your typical ambulatory vet does not have a radiograph machine that can image deep enough to actually get an image of the vertebral body. Sometimes they can get the spines, but to get the actual bodies, you need a big machine. So if you're suspicious of a horse that has really severe back problems, the best thing would be to find an imaging facility, a hospital, or a vet school around you that has a very large radiology machine that could get images of the actual vertebral bodies. There are a few treatments. Shockwave is pretty successful and is what the vet that I work with tends to do for a large majority of his back cases, and we see pretty great success with that. Some of the more severe cases of kissing spines, they can go in and do a couple different procedures, one of which is actually when they cut out wedges of the vertebral bodies so that they're no longer touching. It's a pretty in-depth surgery, and only pretty severe cases have to go in for that. They can also do injections in between the different spinous processes, and those can be fairly successful too, but again, shockwave is probably the most common. And so you can talk to your vet. There is kind of an idea out there that back pathology isn't a thing, that it's all just saddle fit, and the vets that I work with attribute that largely to the fact that up until recently we haven't had radiology equipment that can radiograph deep enough to actually see the vertebral bodies, which are in many cases affected with arthritis, as we have seen in our own clinic. So there are just some tests you can do to see if your horse has back pain. Some of the most common presentations of back pain would be a horse that, when a saddle is applied, they get cinchy, they arch their back, put their head up in the air, don't want to carry themselves properly, or even buck when they haven't bucked before. So you have a great kid's horse and it's starting to get moody and then eventually starts bucking. Or even if you have a baby and you put the saddle on their back and they blow up and you just can't get this horse to stop bucking, even though it's fairly docile on the ground and does really well with groundwork. A lot of that is pain from the back. So there's just a few things you can try. I hope this helps.